parents, they know the importance of regular checkups when it comes to the younger children.
Yes, but when your kid becomes a teen, those regular checkups, not so regular. I don't remember going as a teen. In fact, in a recent survey, only 64% of high school students saw a doctor during the past year for a checkup when they, of course, were not sick or injured. Just checkups here.
And despite how tumultuous those teen years can be, only 10% of teens go to the doctor for social or emotional health issues as well.
Dr. Wendy Anderson Willis, a pediatrician with Nationwide Children's Hospital, is here with us to discuss. And I was a little surprised to hear, well, you know what, let me take that back. I'm not surprised because I didn't go as a teenager.
The surprise comes from the fact that we didn't know the kids should go.
Exactly.
You know, and why, and what are we missing?
Well, we want to see those teenagers every single year.
Really?
And the tough part is that many of them only come in because they have a sports physical form they want to get filled out. That's where we get most of our boys in.
Okay.
But we really want to see every single child every year. We do wellness assessments. We do much, much more than is contained in a sports physical. With teens, most of what we're going to find out is going to be through history, through conversation. Only 20% of what we need to know we're going to find on that exam. So coming in and talking to us about behaviors is incredibly important.
Well, what if a child is reluctant because they don't have a relationship anymore with either a pediatrician or a general practitioner?
Then we need to start one.
Okay.
And for me, my favorite part of my job is listening. I get to listen to their stories. I get to hear them. We have time to take with them. That's a private, we can have private conversations with them. We have the teens come in with their parents early on. And over time, as that parent and as that child get more comfortable with our relationship, that teen may have more time with the physician one-on-one. So with those one-on-one conversations, we learn so much. They can say whatever needs to be said. It's completely confidential. And by state law, I can't tell anyone anything they say unless they want to hurt themselves or someone else. So we have lots of time to talk about lots of issues.
Yeah, that was, of course, the first question is at what age? 13, 14, 15, 16, do they not want mom and dad to be hearing any of this to be helpful?
So a 13-year-old may want that parent to stay right there.
Okay.
And maybe at 16, they may want a little bit of time without the parent in the room. And then maybe a 19-year-old will just come up there on their own. So it really depends on the child and their maturity level and what's important to them.
So how do you tell a helicopter parent it's time for them to get out of the room? That's got to be a tough one.
I've gotten to be pretty good at that over the years.
Good.
Yeah, and you can say it in a really inviting way. So that's what we do, and they seem to be pretty receptive when that relationship is there.
So what kind of things are you finding out from teenagers? Why is this important since we both said, really? You're supposed to do this?
No idea.
Well, there's so many things that are coming up in teenagers that we hadn't seen before, things that we used to see in adults. So there's childhood obesity. We see lots of teens with hypertension, depression. I mean, you name it, asthma. We really work hard to, number one, listen. Number two, encourage and support. And then, I guess that was 2 and 3. And then number 4 is to empower those teens. The best thing that happens to me during my day is to see a teen come in and they're saying, I did it. I did it. I got my blood pressure down. I have control of my asthma where I can play my sport and do what I need to do every day. So really, it's about empowering teens to stay well. We at Nationwide Children's want to keep kids well.
So how long are you a pediatrician for? When is it 18's the magic cutoff? Or
when should you think more about a general practitioner or family practice?
Well, teens across America are choosing to stay with their pediatricians more and more until age 21. So we're getting to see them, when everything is changing, they're going from high school to college or work, so many things are changing in their lives. Sometimes they want certain things to stay the same. So they keep coming back to their pediatrician until 21, oftentimes. We have teen clinics in our sites across the city, and we also have our adolescent medicine specialty clinic. Seeing them, and it's a great experience, I think, for them.
And not only, like you said, it doesn't. That they're supposed to get as well. So start checking into your team.
And you need to let Graham be alone with his doctor in the room at this point.
Okay.
It's time, Sean. It's time. He's about to graduate from college. Thank you. Thank you, Dr.